and we are going to get started in just a couple of minutes. Okay, now we are online, so you can see me. I cannot see everybody, but I know that we have already 6 attendees online, so we are ready to get started with our first online free seminar in English. We've always done this in Spanish, so we're going to do it for the first time in English, and this is going to be recorded so that many of you that once we this lecture is recorded, we're going to upload it in our Facebook page, and we're going to just upload the links so that you can actually access the link and you can review this lecture in your free or spare time if you need to follow up anything else with it. So this is our first slide, and it's 7:04 p.m. here in Augusta, Georgia. And I want to thank everybody that is actually following us. And we are going to talk today about dental photography and how can we make dental photography very, very simple, and how can we apply what we're going to learn today in our everyday practice. And I'll show you really how important dental photography is and should be, and why you should consider using dental photography in your dental practice, not only because it's going to help you develop a good treatment plan and view the photos of your patient and analyze each case individually in your own spare and private time. But at the same time, it's good because you are going to be able to actually show other patients that probably can relate with many of the treatments that you've already done in your practice. And obviously, they will definitely they can identify each and every one of them. They can identify with the procedures, and you're probably it's gonna help them understand why you are offering a particular procedure. But before we get started with the actual dental photography lecture, I want to talk a little bit about George Eastman, and I probably many of you know who George Eastman is, and if you don't, I'm going to tell you a little bit about him today. George Eastman obviously was an American innovator, and he was born in Rochester, New York, and he was the founder of Eastman Kodak, and we've all heard about Eastman Kodak. So we know that one of the things that George Eastman actually developed was actually the paper where the photos were developed, and the quality of the paper was what made the big difference. Before George Eastman, we just had regular, plain, simple paper where photos were developed, and the downside to that type of paper was that the photos will not stay on the paper for a long period of time. So even though you took a photo because you went on a vacation trip or something like that, you really had very little time to actually view the photo after it was developed. Well, after George Eastman developed this Kodak type of paper or Kodak brand, now the photos can be developed on this paper, and this paper would actually hold the image for very long periods of time. And that's when photography actually just, I think, that changed the world. And George Eastman became a very wealthy, very, very wealthy man at a very young age. So one of the things that George Eastman actually did once he became very wealthy was, I think, 32 years old, if I'm not mistaken, when he was now a very wealthy man. One of the things that he started doing is that he was a huge philanthropist. He started investing or giving away his money, the excess that he had, to different charities and different organizations. And one of these organizations is actually the Eastman Institute for Oral Health in Rochester, New York, where many dentists for many, many years have been training themselves in different specialties. And that's actually the school that I attended, where I did my residency after I graduated from dental school. So that's why I know this story. But I wanted to mention him because definitely the things that we are doing today, everything started with what he discovered or what he actually developed. And this is a picture of the Eastman Institute for Oral Health in Rochester, New York, where obviously George Eastman had a huge endowment that is still there, working and building up interest that this institution actually uses to help, to bring patients in, treat them, and at the same time to have many residency programs and kind of hold them on together during all these years, because this has been there for many, many years. Okay, so now we're going to go and get into our topic. We're going to talk about dental photography. I just want to kind of pinpoint to you that there's four things that I think that a dental photography it's a key or very important uh, um, actually it's a very important tool that we can use in our daily practice. And the main reason why I think it's an important tool is because obviously it's a great communication tool. You through dental photography, you can show your patients, you can show other colleagues, you can communicate with your periodontist, you can communicate with your orthodontist, you can communicate with the oral surgeon. So you can communicate with the team members, or you can communicate just simply with other patients, kind of to show what you do and what they should expect as a result of your own work. So that's a key element in dental photography. The second one that I think is very important is actually patient education. How many times do we have patients that show to our practice, that come to our practice, and they really don't understand. They know that they have a problem, they just don't understand what can they do to solve their problem. They know that they have a problem with their smile probably, but they don't know what can they do, what can you offer for them to actually solve their problem. That's the number one reason. But the second reason is that, let's say that the patient kind of went through the internet and kind of got some dental magazines, and he kind of knows that he wants some veneers or he wants a tooth whitening. He kind of knows the direction that he should be going or what he's looking for, but he doesn't know exactly what steps should be taken in order to achieve or to go from point A to point B. So dental photography, and at least the way I do it, and you'll see some of what I do. Everything that you're going to see today is what we do at the school. I work very closely with Dr. Fernando Haddock, that I know that he is following us actually today, and we work very closely. So everything that I'm going to show you today is we've developed together at the school for our students, but we use as well to teach dentists like you through online courses or actual courses at the dental school, and obviously hands-on courses at the dental school, where we teach them the concepts and the techniques that they should utilize to actually achieve high quality photos. And that's what you're going to see here today. But when I was saying patient education, these patients, through this sequence of photographies, they're going to really understand every single step that you decided to take from point A to point B, so that you can achieve a really high or good result. And that for me is key, because these photos will actually answer the questions for you. They will answer the questions to your patients, what they really want to know, and they will answer it in a very graphical way. The third reason why I think that the photography is important is because treatment planning. In today's world, in today's dental practice, we normally work in a very busy environment. I'm a very busy person in my practice. I'm a very busy person because I have to share my practice time with my teaching time, and I have to put effort in both of these areas. So for me, dental photography is key, because it lets me have my patient's mouth, his face, the way that he smiles. Everything is in my computer. I can bring it home, or I can use it in my office hours when I'm not seeing patients and when I'm not with students. So now I can sit down, relax, and look at each photo and come up with a really good treatment plan or a really good option for my patient. At the same time, with many of the digital tools that we have today, like digital smile design, all these tools that we have today for treatment planning, we can actually do that in our computers, and we need to have high quality photos in order for us to be able to achieve that kind of treatment plans. Marketing your practice, and that for me is like the winner, I would say, out of all these four, because we have to, today, in today's world, we have to market our practice. We got to show the world, we got to show our community what is it that we do, what is it that we offer in our practice, and the way that we offer it, the environment that we offer it in, and how professional we are when we look at everything that we do. And good dental photography will actually show how professional we are in actually delivering the service, communicating and delivering the service to our patients. So these are the four key elements that I think that we're going to go through each and every one of these, so I can give you some kind of examples. Let me show you this first example. How can I use these photos as a communication tool? So I'm going to tell you a little bit about this case. If you look at the photo on the left side of the screen, of your screen, you will see that I'm actually restoring a single implant on the anterior segment of this patient, on tooth number 8 to be precise. So we're going to restore tooth number 8, and we have an implant placed. We have a zirconia abutment, and now we have an Emax crown on top of that abutment. We did an impression, and we send it out to the lab. The lab sent us back the crown, and even though in the cast, the crown seemed to be very nice and uniform, both incisal edges were at the same level, tooth number 8 and 9. I'm talking about tooth number 8 and 9. Once we actually fit in the crown, we seated the crown to try the crown in patient's mouth. Now you can tell on the photo on the left that the number 8 is actually shorter than number 9. But that is not the way that it was in the stone. So how do we communicate with the lab? How do we tell the lab we're having this problem? It doesn't show up in the cast, but we still need you to resolve this problem. But we don't want to retake a new. We don't want to take a new impression. We want to do something simple. So what I did for this patient is I actually added some resin composite to the incisal edge, as you can see in the photo on the right. And with that composite in place, I kind of like, got to the actual length that I needed that restoration to be. Then once I obtained that new length, I did a putty matrix. I actually took an impression from the lingual so that I can achieve this putty matrix that you see there. And I'm going to send that putty matrix with the actual fragment that of composite that I added that you see on the left side, and I'm going to send it back to the lab so that the lab can actually add porcelain to that crown and send it back for a retry. And if you see here on the photo on the right, now you can see that both 8 and 9 are at the same length. So this is one really good example. And in America, this is such a big country. And you have labs all over America, all over different states. And sometimes you have a preferred lab. Let's say I'm in Augusta, Georgia. Let's say that I have a preferred lab in California. Well, I got to mail that. So there's really no other way that I can communicate. The only way that I can do this is through Skype and through dental photography. So I think that, dental photography will actually give the lab a tool that if I am going to Skype with the lab tech so that I can talk about a case or this particular case, he's actually going to be seeing real life photos that I took and I emailed into him so that we can have a better communication. So definitely it's a very strong communication tool. Now, this is the final result. So this is from point A to point B. This is the initial crown with the short crown, and then we go to the photo on the right. You can see the final smile where we have both 8 and 9 exactly at the same length. Patient education, and I'm going to show you. This is what I do every single day. I take at least 150 to 200 photos a week. I do a lot of dental photography for myself. I do a lot of photos for my students. So obviously I'm using my camera every single day and I take a lot of photos a week. But I take photos of everything that catches my attention. And I'm going to tell you why. And this is a really good example. See, this patient comes to the practice. He's in my practice for a recall exam. So I asked the patient, you have anything that bothers you, anything that, any pain, any discomfort, any hypersensitivity? Patient says, no, doctor, I'm just here for my regular checkup. I just need to get my teeth cleaned. So I do a screening exam. I'm going to do a periodontal exam. I want to make sure everything is okay. And while I'm doing that screening exam, I find this tooth. This is a maxillary molar. And initially what caught my attention was actually that portion of amalgam that you can see that has fractured off. So I told the patient, you have an amalgam here that is fractured. Have you noticed that? And the patient said, no, I haven't noticed it. So the best way for me to communicate at that moment with my patient is I'm going to take a photo. So I grab a mirror, I take my camera, I retract the lips, I dry the tooth, and I take a photo. And there's my photo. Now, I put the photo in the computer and I show it to the patient, just to kind of so that he can understand what I'm trying to explain to him. And when the photo is blown up, now we can see that on the distal marginal ridge of that first molar, the patient has a crack, it's a fracture. We can see that there is a space in the center of that marginal ridge. So there's actually a real fracture in that portion. We don't know what the extent of the fracture is, but we know there's a fracture. Okay, so the patient says, well, you know what, doctor, nothing is bothering me. And I think that you and me, or everybody that's actually listening to us today, will be able to relate to this kind of answers when we tell our patients that they're having some issues. So the patient just replied to me saying, you know what, doctor, it really doesn't bother me. Probably it's been there for a while. I've had these amalgams for many, many years. At this point, I just want to wait and see if I have any symptoms. So the patient goes, gets his teeth cleaned, and he goes home. 2 weeks go by, and I get a call from the patient, and he says, you know what, doctor, I'm having, yesterday, the tooth that you mentioned started bothering me. So he comes in, and I remove the amalgam. And when I remove the amalgam, and that's the photo that you see on the right, look at the amount of cracks that actual tooth has all the way to the pulpal floor. So at this point, we understand why is our patient having hypersensitivity. And this just happened out of the blue. He relates that it happened very shortly after he saw me, But it was just a coincidence that we found this lesion. But the coincidence was made because of the photo. And it was a really good tool that we had the initial photo, so that the patient understood, and he actually visualized what was going on with his tooth. So at this point, hypersensitive, fractured. We didn't know what was the extent of the fracture. Now we're going to send the patient to the endodontist. There was no other option. It was very, very hypersensitive. So when we refer the patient to the endodontist and we write the referral prescription, we actually tell the endodontist, please go ahead and view with the microscope and make sure that this fracture line doesn't go all the way through the tooth, so that the tooth can really be restored. At this point, what is the option that we have to restore the tooth? Well, the only option that we have is actually a full coverage, a full crown. And that's what we did for this patient. But the most important thing here is not the actual clinical case. The most important thing to understand is that we are educating our patients, number one, but at the same time, we are actually putting these photos into his chart. So we are documenting what's going on. We are documenting actually that the patient came to our practice and he had a fracture before we actually did anything to him. This is the way that he presented to the clinic. So, in a way, we document every procedure. And if you ever have any issues, you have this powerful tool. You have actually the photo that was saved under the patient's chart to prove what you did to that patient and why you decided to do it this way. So we build up the core, we prep the tooth, and there is a fracture again. And now we're going to go ahead and take an impression, send it to the lab, and finalize this treatment for the patient. The other reason why we use dental photography, right? We have treatment planning and team communication. And I am going to give some time for everybody to ask questions. And as you can see in this software, we have an area where you can actually you can click on that little hand and you can raise your hand, and that will let me know that you want to ask us a question. And if you do not speak English, I would be more than happy to take the questions in Spanish, and I will translate your question into the English language, and I will answer the question in English. So I will stop once I finish this first portion, and then I will open everybody's mic so that we can have a small chat, and I will open this for discussion and for questions. So treatment planning and team communication. How does this work, and how can dental photography help us in this very important area of dentistry? So let me show you this case, and I'm going to show you photos because this is a dental photography lecture. So I'm going to show you a lot of photos, and I want to show you what can we do and how powerful this tool is for us in our daily practice. So we look at this photo, and we say, okay, what did this patient need? What do we need to do for this patient? So I'm going to analyze the smile of this patient. And the first question I'm going to ask myself is, well, how can I classify this smile? Does the patient have a low smile line? Is it a medium smile line? Is it a high smile line? I mean, how much teeth display does this patient have? So this type of information I can achieve from this photo. And if you look at this photo, we can all agree that this patient has a medium smile line, an average smile line, but we can see as well that the papilla between 7 and 8 is hypertrophic compared to the papilla between 9 and 10. So the anatomy or the shape of the papilla, both of these papillas are different. We can all as well see that the patient has some very distinctive wear on both central incisors. So at this point, I can be thinking of, would there be an occlusal issue that would be causing this type of wear on this patient? Do I need to examine the occlusion of this patient to kind of like come up with a treatment plan? Then the other thing that I can view in this photo is that the patient has a diastema. And actually, the patient came to the practice initially because she wanted that diastema to be closed. So you can see in this photo, we have a very broad spectrum view of the patient, and we can really plan to see what is that we can offer this patient. And there is the hypertrophic papilla that the patient presented. But this is that same day the patient came to our office, we take an alternate impression. Now we have the full photos. We have full face photo with smile, and we have a frontal photo, we have a lateral photo, we have the closer smile photo, then the intraoral photos, and then we do the segmental photos as well. And I'll show you all the photos that we use. But now we have a cast, and we're going to develop a wax up on this cast. So what kind of information do I get from this? Well, I can use her intraoral photos, I can use the cast photos, and I can do a digital wax up. And then that digital wax up, transform it using the digital smile design. I can transfer that to a real wax up. And then out of this wax up, and you can see that at this point, we have modified the gingival margins or the zenith of these central and lateral incisors. And in order for us to explain to the patient if she would have the need for a periodontal crown lengthening procedure, she now would understand by looking at our wax ups and looking at the mock up that we're going to deliver for her. And I'll show you that in a minute. But now we have a view of the embrasures, we have a view from the lingual so that we can show this to the patient as well. And all this was obtained. Initially, we did a digital smile design for this patient. And out of that digital smile design, we decided if we wanted square teeth, round teeth, the length of the teeth, the width of the teeth. Everything was designed in the digital smile design before we went to the wax. So this is definitely a face-related treatment plan. So we're looking at the facial aspect of the patient, and we're taking that all the way down to her 6 anterior teeth or 6 anterior sexton and 2 bicuspids if needed, to kind of analyze how much do I have to deliver dentistry wise in order for me to achieve a great improvement in her smile, and at the same time communicate with the patient. Now we're using another tool that we use, a digital tool, is a golden proportion ruler that we have in our computer, and that we can take a photo of our wax up. We can then put this ruler on top of the wax up, and then we can say, okay, do I have the correct height to width ratio? Is this in golden proportion? Is this an ideal proportion? And is it going to be aesthetically pleasing to my patient? See, every single decision that we are making is based out of our photos and our wax up. We have not even tried this into our patients. We're just analyzing, we're planning. We're trying to put everything, all the pieces of the puzzle together before we actually see our patient. So when the patient comes back to our practice, now we have all this information, and now we're going to get another set of photos. And what are those set of photos? Well, we take an impression, we obtain a matrix, a putty matrix out of our wax up that we did with all these photos and all the digital smile design and all the wax ups. And now we have this putty matrix that we're going to do both impressions, a putty and a light body impression material, so that we copy very, very in a very defined way, in a very detailed way. We're going to copy every single detail that we actually place into our wax ups. And that is now going to go into our patient's mouth. And this is what we call the aesthetic mock-up. And you can see that in this aesthetic mock-up, we're actually taking frontal shots, and we have lateral shots, and we have full face shots. So, and then we actually develop a video. We have a conversation with our patient, so that we're going to analyze now the incisal edge position. We're going to analyze the canines. Are they giving her canine guidance? Is there any interferences in this new position of her teeth, if we want to call it that way? Because we're going to have to add either composite or ceramic to actually achieve this kind of results in our patients. And at the same time, you can see that in the lateral photo, we've added some of the material, some of the wax was added to the gingival portion of the teeth. And now the patient will understand, why does she need a crown lengthening procedure or just a plastic surgery of the gingival tissue to kind of give us a better contours on the teeth that we are going to restore, so that we can end up with a better and an aesthetic result. So, I just want to give you, there's a lot of information I'm giving you out right now. We are not discussing here any dental topic. We're just talking about dental photography, or the way that photography relates to dentistry. But definitely you have seen that, in many ways, dental photography is a key element in everything that we do every single day. And not only for restorative dentistry. Please, you have to understand that this is good for orthodontists. This is great for prosthodontists. This is great for general dentists like me and many of you guys that are following me here. And it's great as well for oral surgeons. Anybody that needs to communicate whatever they're doing to their patients, this tool is excellent for. And I'm going to show you one more here. Marketing your practice. How many times you have patients that, I want to bleach my teeth, I want to close this gap or diastema that I have between my teeth? Well, this is a before and after, immediately, the same day that the treatment was delivered. Before and after. This is after bleaching and right after the the teeth were restored. So this is immediately after. That's why you can see a small shadow in that small class 4, because obviously these teeth are dehydrated. This is right after the rubber dam was removed. But what I want to tell you is that this is the way that you market your practice. And I'm going to show you, this is just one of the cases, but I'm going to show you a highly aesthetic case. And this is the way that we actually do photography. This is how our patients come to our practice. We actually take a full face photo, and we just want them to be themselves. And then we talk about them and we show them this so that they can really, this is for me, the feeling that I get when I have this kind of photos in my practice is that I kind of get a little bit more involved in my clinical cases because I want to make these people happy. And happiness or smile design doesn't mean that I got to do 10 or 12 veneers. No, happiness or smile design means that I can restore half of a tooth and just improve a patient's smile. And if this in his face shows a very nice smile and shows brightness in his eyes, for me, that's happiness. And that's all I need to do for a patient. And this is this case right here that I'm going to show you right now. This is a patient that came to my practice. He only had one tooth that was bothering him. Every single other tooth in his mouth was virgin teeth, no restorations. The patient was very, very compliant with obviously with follow-ups and with home care. But he was just dissatisfied with this restoration. Now, this restoration was in his mouth for I think 11 or 12 years. So he had a fracture doing a sport event, and he had this restoration done 12 years before he came to see me. So probably this restoration, when it was done the first time, probably the shade matched a little bit better than what you're seeing right now. But definitely at this point in time, this restoration needs to be modified. It needs to change. It needs to be redone. But one of the things that I want you to see, and this is another specific way that you can use dental photography, is that look at the neighboring tooth. Look at tooth number 9, and look at all the halos, all the shadows that you have on the incisal third. Look at the hypocalcification spots that you have everywhere, white spots. Look at the gray. Look at how much information, how much intrinsic shades this tooth has in its incisal edge. So the question at this point is that if I want to do a multi-chromatic restoration and I don't have this kind of information, how in the world should I expect to achieve a good result? It's impossible. This is why I like to do dental photography, because with this patient and with many other patients that I see in my practice, this is what I do. I sit down and I look at their photos before I even reschedule them to actually do the restoration. I want to look at the photo and I want to understand what is it that I need to do to try to achieve that kind of results, because this is a very high aesthetic case. Patient wants to have this tooth number 8 be identical as tooth number 9, and that is my goal as well as a restorative dentist. And this is the before and after, right after the restoration was completed. This is 5 days after the restoration was completed. So we isolated, we did all the photos, we got all the photos to support this case, but this is the after result. And we only restored that portion of the tooth that the patient was missing. This is not a full veneer. So obviously we had to give a lot of aesthetic enhancement to that incisal third portion, because that's the area where the patient had all this information, where he had all these gray areas, white spots, white halo in the incisal third. That's where he had all that information. And this is the final restoration. And you can see in both of these shots, the left photo and the right photo, you can see the biointegration of the tooth with my restorative material, because my restoration is only, 4 millimeters from the middle third all the way to the incisal edge. And the rest of that, what you're seeing in his full smile, is his own natural tooth structure. So this is a very conservative approach. But let's go back to photography, because I think that you've all understood at this point why dental photography is so important. So we have 9 people following us, and we're going to make a very small break. I'm going to give you guys probably 5 to 10 minutes to give me to be able to come up with some questions or comments. I'm going to open everybody's microphone, and this way I'm going to be able to hear you guys, and you can actually ask the questions in Spanish, and I will be more than happy to translate these questions into English, and then I will answer them in English. If you want to, or you can make your question in English, well, that is okay as well. So let me go ahead and open. I'm going to just make the screen smaller for a minute, and I'm going to open everybody's microphone. Let me do this. Unmute. All right, so right now everybody is, I've opened everybody. Let's try to put the volume a little bit down so that we don't have a lot of noise. Okay. Uh, the microphone is open. So please, if you have any questions or comments, this is the time to do them. So I have Daniel Hidalgo, Edgar Vargas Quiroga, Esteban Montoya, Fernando Harper, David Iván, Gustavo Alberto Gómez, Salvador Adame, Sandra Margarita Jiménez y Jimena Velázquez Pérez. Así que si alguien tiene alguna pregunta o comentario, este es el momento.
Es el único momento que le entiendo.
¿Podría repetir la pregunta? Doctor Vargas, ¿quiere hacer una pregunta?
Daniel, que quisiera hacer una pregunta. Doctor Vázquez, que quisiera hacer una pregunta. Bueno, el tipo está esperándote ahí. Sí, mi amor. Que doctor Vargas, ¿puedes repetir la pregunta?
Yo lo estoy escuchando. Y cualquier otra persona puede hablar con los micrófonos abiertos. Pueden también escribir preguntas. Si ahí tienen el teclado, si quieren hablar por los micrófonos están abiertos. A ver, aquí tengo algunas preguntas. Okay. Y veo que tienen ahí tienen abajo el botón para las preguntas, así que si tienen alguna pregunta, lo pueden hacer directamente. Okay, so ¿me pueden escuchar?
Sí.
Okay. Doctor Montoya, veo que ha levantado la mano. ¿Tiene alguna pregunta? Doctor Montoya, ¿usted me escucha? Ok. Entonces, si nadie tiene alguna pregunta, voy a continuar con la presentación. No se olviden, pueden levantar la mano, pueden escribir la pregunta también, que yo la estoy viendo aquí, la tengo en la pantalla, y obviamente cada cierto momento yo daré una pausa para que puedan hacer preguntas. Solamente quisiera que me confirmen, por favor, si alguien me podría hablar, el doctor Salvador o la doctora Jiménez y la doctora Sandra, si alguien me podría hablar por el micrófono para estar seguro de que me están escuchando.
Se escucha perfectamente.
Sí, ¿quién habló?
Sandra Jiménez.
Doctora Sandra, muchísimas gracias. Ok, solamente quería saber si me estaban escuchando.
Doctor Romero, ¿me escucha?
Yo lo escucho perfecto, doctor Jado. Muchas gracias por estar aquí con nosotros y ayudarnos.
Por nada.
Perfecto, entonces vamos a seguir. Voy a cerrar, voy a poner mute todos los micrófonos y voy a seguir. No se olviden bueno, el doctor Vargas me dice que sí me está escuchando. Y eso es lo que quería decir, simplemente que me estén todos escuchando, ¿no? Vamos a seguir con la presentación. All right, so we stopped for a while because we were wanting to know if people wanted to have questions, and I noticed that there are some people that are actually writing down some questions. So if you have any questions, please make sure that you can either write them down, you can type them down, or you can just raise your hand and I'll open the microphone for you. So now we're going to talk about the basic armamentarium that we need to have in order for us to be able to obtain photos of the quality that you just saw right now. So kind of I want you to relate to that because there's many cameras out there and there's many cameras that can be used for dental photography, but that doesn't mean that every single camera that you can find out there or the simplest camera, the simpler cameras are going to give you the opportunity to achieve the exact same results. So that's something that you have to keep in mind. So there's two types of cameras that we have in the market. Ones are called the DSLR cameras, and the other ones are called like the point and shoot. So obviously the DSLR camera is a more complex camera. You have a larger body. You have to have a separate lens. You're gonna have to buy either a ring flash or a point flash, and so they're more sophisticated cameras, and obviously because they are more sophisticated, they are more expensive as well. On the other hand, the point and shoot camera, they're very simple cameras, and the way that they are used is actually the way that they are called. You just point, shoot, and you get a photo. So there are no detachable lenses, there are no special flashes. Everything is built in this small camera. Now, you can either buy a specific point and shoot camera, like the one that you see, the G10 that you see right here, that is specifically made for dental photography, or you can buy any brand or any type of very small point and flash camera. And probably if you use that camera in a macro mode and you can control in that camera the amount of light that is exposed from the flash, you will be able to obtain decent photos for your diagnosis. Probably they're not going to be as high quality as the ones that I'm going to show you today, because the ones that we do at the school, either me or Dr. Halo, the ones that we do at the school, we actually do using the digital single lens reflex camera, the DSLR cameras. But for many, many years, personally, I don't know Dr. Halo, but myself, I used a point and shoot camera for many years before I jumped into the world of DSLR. So I know that they can be used. The thing is that the quality of the image is not going to even compare to what you can achieve with a DSLR. So my advice, if you have the means, the money, the economic means to buy one of these cameras, this is the way to go. You're not going to go wrong. And once you buy one, my camera is 8 years old, and I don't even plan to change it. It has no problems. It's an old camera, but it still does really, really good photos. And I'll show you all the ones that you've seen here are either taken with my camera or with Dr. Hado's camera. And his camera is probably as old or a little bit younger than mine, but it's not that many years of difference between his camera and my camera. So what are the advantages of a DSLR camera? Obviously, like I said before, the highest image quality. It's upgradable. You can always buy a new lens. You can buy better light for it. You can buy many accessories for the camera. So all this makes this a very obviously a good advantage of this camera. And they have variable lighting. You can have either the ring flash, you have the point flash. Me and Dr. Haddock at the school, we have our own little photo studio, and we have umbrella flashes. I mean, we have a whole bunch of equipment, but you can use anything you want with these cameras, and all these accessories. Obviously, they have a cost, but they will really help you, and it will enhance the quality of the photos that you're going to obtain. Now, obviously, they have a disadvantage, and the main disadvantage that I see on these cameras is not the price, because everything in life has a cost, and with time and with your work, you are delivering a service, you are delivering a dental service, you will get your money back. That's no questions asked on that. But one of the main disadvantages is actually the weight of the camera. They're heavy, and the one that I have is actually the one on the right side, and the one on the left side is the one that Dr. Hallock has. I mean, he has an Nikon as well, but he uses a ring flash. I use a dual point flash. So even though both cameras are heavy, my camera is a little bit heavier than his, because this flash, as you can see, is a larger flash, and obviously it has more weight built into it. So and I do everything. I hold the camera with one hand. I have my patient retract. I hold the mirror with the other hand, and I'll show you step by step the position that you have to have in order for you to achieve high quality photos. This is the components of the camera: the body, the lens, and the flash. Now, the body of the camera, they change rapidly every single day, every single month. You have new things, like anything in technology. Every day they're updating them, but that doesn't mean that you have to go crazy and buy the most expensive camera that you have, or that you really have to buy a very sophisticated camera. You can you can buy, like myself. I have a D3200 Nikon. It's an old camera. It's a basic body, but it does high quality photos. I don't need to have a lot of function in my camera, because all I'm going to use my camera for, that camera I specifically use only for my dental practice. I have another camera at home that I use for my family events. That I can spend anything I want. But for my practice, I need a basic camera. I just need to have a 10 megapixel resolution minimum. obviously it has to have an APS-C sensor, and this is just that glass screen that you see on the bottom. This is the digital sensor that the camera will actually use to actually view the distance and do all the autofocus functions. I don't use any autofocus, but that's one of the advantages of the digital camera. And then obviously you're going to have an LCD screen, a 3-inch LCD screen minimum, so that that viewer has to have a good size, so that when you take the photo, and this is a great advantage of digital camera, is that you take the photo and you can actually look at your photo and you can evaluate your photo and you can evaluate the quality of the photo. If you're happy with the quality, then you can go ahead and continue with your photo session. If you're not happy, you delete and you take a new one. The macro lens. This is a very important tool of the camera, because in dental photography, every single picture that we do, every single photo that we take is a macro photo. Macro meaning that we are very close to the actual subject. So we're gonna blow up a very small image. We're gonna make it large, and that is what the macro lens help us actually obtain. The macro lens that I use is a 105 millimeter macro lens, but you can buy one between 85 and 105 millimeters, so that you can achieve good results. Now, the greater the millimeter, the higher the number, the closer you're going to be to your subject. And for me, that is key. The lower the number, the further away you're going to have to be to obtain the same result. For me, I like to be closer to my subject because I think I can control light better, and I just feel more comfortable like that. But this is me because I've been using a 105 for many, many years. So obviously you can actually add to your macro lens. You can actually add magnification lenses that they will screw on the front of the lens, and that way you can even get closer to your subject. But for what we do, enough is to have the 105 millimeter macro lens, and you're going to be happy with what you're going to achieve with that single lens without adding any additional magnification. Now, the magnification markings on the lens. This photo that you see on the right is actually the photos of my lens. And Dr. Haddock has a lens that is very similar to mine. It's just a different brand of lens. So they have different settings for his camera than I have in my camera. But we both have the benefit of having this sticker or marking in our lens that, as you can see, is actually made for dental photography. Why? If you look at the markings of my lens, you can see that at 110, that is the distance from the subject, I'm going to use f8 as my f-stop number. That's the speed of my f-stop. That's the aperture that I'm going to have on my camera. And now you can see that with that f-stop and that distance, I'm going to be able to achieve a very good full facial photo. So this camera is actually telling me, with this 105 macro lens, if you are at 110 from your subject, you're going to use f8 and you're going to be able to achieve a full face photo. So it's actually letting me know all the actual settings that I need to have on my camera. On the other, and the next step, if I want to have a full, all front teeth, MI position of the maxillary and mandible, or just an occlusal maxillary or an occlusal mandibular, I'm going to use the 1 to 2 range, and I'm going to use the F22 stop. And as you can see, that is on the sticker as well. That is on the marking. So you can actually copy the distance and the f-stop, the markings that are on this sticker, and you can use exactly the same distance and exactly the same f-stop, and you're going to achieve the same quality photos that I'm going to show you in a minute. Now, if you want a more macro photo, like let's say that you want to achieve only 4 teeth or 6 teeth, you go to the 1-to-1 ratio, 1-to-1 distance from the subject, and now you're going to use f32 as your f-stop. And I'm going to go and I'm going to explain to you what is an f-stop. But for now, I'm just giving you this information so that you can see that all these markings that actually come in the lens are going to help you achieve, are going to make your work easier, because there's nothing to remember. Everything is going to be very, very simple. Now, the full macro 2-to-1 relationship, we only going to get 2 teeth in this photo, and we're going to use the f32, the f-stop at 32 as well. So as you can see, the longer the focal length, the narrower the field of view. The closer I am to my subject, the least amount of structures that I'm going to get in my photo. That is basically what I'm trying to say here. And this is what I'm trying to explain here. You see, you have these 2 photos. They're both macro photos because you see everything enlarged. But even though they're both macro photos, there's one that is even more macro or closer to the subject, narrower field of view, because you're closer to your subject. That's the right photo compared to the left. See, on the right, you can only see the butterfly and you can see part of the flowers. Everything else is blurred out on the back. So you are focusing basically on that subject. And they're both macro photography. Now let's talk about the flashes. Yes, you have the ring flash and you have the dual point flash. Now the question would be, why do I have these both of these selections, and which one is best for my practice? Well, the answer to that question is basically, if you are a new photographer, that means that you are just getting into dental photography. You're just getting started. And obviously, you want to start out with, with spending the least amount of money possible, so that you can buy the equipment and start taking photos. I would highly recommend that you buy a ring flash. Why? Because a ring flash is going to be good for frontal view, for posterior, for front teeth, anterior teeth, for posterior teeth, for full face photos. I mean, it's a flash that's going to be good for many shots. On the other hand, the dual point flash is a great flash. It's an expensive flash, but it's only good for aesthetic photos. So you can only use it to take the smile photos, the front teeth photos. It's very hard to take photos with this flash of lateral views or occlusal view of posterior teeth. So in my case, I'm going to give you as an example myself and Dr. Halo that we work together. In my case, I have both flashes. I have the ring flash that I use for posterior teeth, and I have my dual point flash that I use for my aesthetic cases. Dr. Halo, he only uses a ring flash. He does very good photography, but he only uses a ring flash. So he's used to using that flash. He's used to controlling the amount of light that his flash can emit, and he's used to actually choosing the right f-stop for every single photo that he takes. So that is one good example of one dentist that only uses one flash and obtains really good photos of anything that he can take. In my case, I just use two different flashes because I try to focus more on the aesthetic portion of what I do, of my practice, because I actually teach aesthetic dentistry. So obviously I gotta have a lot of high quality photos, very aesthetic photos, but at the same time, photos where I can control better the light. Because at the end of the day, controlling the light is key for aesthetic dentistry. And I'm going to show you a couple of shots so that you can see what is the difference. So this is a photo. I'm going to show you this photo. And this is a good photo. It's a high quality photo. This photo was actually taken by Dr. Halleck. This is a high quality photo. He's used very well his black contraster. We can see the nice pink tissue. We can see the teeth. We can actually, we can see every single detail. But at the same time, what can we say about this photo? I mean, me that I'm used to, seeing photos every single day because I take a lot of photos. If you ask me, I can say, well, this is a really good photo, but there's too much light. I don't like the lightening of the photo because I like to see more shadows, because to me, they give you more detail and they are more aesthetic. And I'm going to show you, I'm going to prove you that I am right. So this is a smaller, obviously a smaller flash. It's easier to use. It has a consistent light. It's always the same amount of light coming out, so you're going to get consistent photos, but it's not good for aesthetic detail. And I'm going to prove that to you. See, this is a photo that I took from a patient. What is the difference between this photo and the previous photo? You see, now I'm controlling better the light. We have some shadows. There's less light involved in the photo. So if there's less light, the actual photo is going to show me more detail. Now, when I say detail, what am I referring to? Well, I'm referring actually to, look at the halos on the mesial and distal incisal line angles. Look at, the translucence areas. Look at the halo on the incisal edge. Look at the mamelons on the dentin on tooth number 8. Look at that spot on tooth number 9. Look at the fracture on the incisal edge of number 9. And look at all the intrinsic effects that both of the central incisor and every incisor, laterals and centrals included, have on this patient. So this is the difference between ring flash and dual point flash. So the dual point flash is larger, it weighs more. Obviously, it's more difficult to use because you have to learn how to handle these lights, these dual point lights. You can either put them further apart or you can bring them closer together. They have flexible lighting options, but they're more difficult to use with mirrors. They're very difficult to use with mirrors, and obviously they are better for dental work, but this is a more expensive flash as well. So just to kind of show you and put this more into perspective, on the left side ring flash, on the right side dual point flash, and we all can agree that both photos are really good quality, but there are differences in between. There are differences in each of these photos. One shows more detail, the one on the right. The one on the left is good quality, but with less detail. Which are the accessories that we need to have in order for us to be able to do dental photography? Well, we need retractors, definitely. We are going to need an occlusal mirror, like the one that you see on the middle, and we're going to need to use a lateral mirror, I'm sorry, that is on the right side of the screen. Now, that lateral mirror is not only used for lateral shots, it's used as well for occlusal shots when you want to take quadrant shots and not the full arch photo. So this is the full arch photo, you will use the occlusal mirror. But for segmental or quadrant photos, you will use the lateral mirror for the occlusal view. Okay? And we're going to show you here every single step that you need to take in order for you to achieve high quality photos. So the first photo, non-retracted photo. This is the typical photo of a smile. So this is a photo of a smile. There's no retractors involved here. We just ask a patient, and I always tell the patient to close his lip, to keep it, just relax the lips, and then I'm going to count to 3, 1, 2, and 3. And when I say 3, I want him to give me a very nice and natural smile. When I say 3, I'm ready for the shot because I want to catch that smile. Because normally, one of the most difficult things for our patients is actually to smile, for whatever reason. It's actually to smile in our office, and we want to capture that smile as soon as he really gives us the best part of his smile. Not when he's trying to relax the lips again. So that's why I count for them. This is a retracted photo. So now you know the difference between the previous photo and this photo. So the previous photo, lips non-retracted. This photo, lips are retracted using these retractors, and now you can see that there is no lips involved. So they're used to retract lips and cheeks. They're placed by the doctor but held by the patient, and I'll show you exactly. We will show you here in this presentation how do you get that done. And there's a large end and a small end. With the large end is for this photo, and it should not appear in the photo. So the lips or cheeks should be very well retracted, and this should not appear in the photo. The occlusal mirror, and this is used obviously for the occlusal maxillary and mandibular shots. And here's a photo, an occlusal photo of the maxillary arch. The buccal mirror, used for the quadrant, buccal, or lingual areas, or it can be used as well for quadrant occlusal shots. This is a lateral shot. As you can tell, we're using the mirror as a retractor, and we are actually focusing on the mirror, and that's where the shot comes from. We're actually photographing the reflection of the teeth onto the mirror, and we are taking the photo of the reflected teeth on the mirror. And this is the same mirror used for a lingual photo of a maxillary arch. This is the same buccal mirror used to take a quadrant photo or a segmental photo of an occlusal view of these two bicuspids. So this is when we would use a mirror like this for an occlusal shot or an occlusal photo. The black contraster. For me, the black contraster is one of the best tools that you can use for aesthetic dentistry and for diagnosis. Now, I'm going to prove this to you. This is the one that we use in the school. This is the one that we have, the one that is made by PhotoMed. You can make this as well as out of cardboard. You can buy black cardboard and you can cut them in this kind of like this shape, and you can use it to take your photos, and you'll make them just disposable. But this is a very inexpensive way to actually create your own contraster and just a throwaway contraster. Now, you see these two photos. There's the same patient. One photo with the contrastor, the other photo without the contrastor. What do you notice? See the amount of noise in the background? Because we have the tongue, everything is in the background. If you look at the left photo, we're just focusing on those two centrals. And basically, I am focusing on that fractured incisal edge that I want to restore for this patient. This is an actual patient of mine. So you see, this is what the contrast does for you. It sets your eyes on the important aspect of your photo. It just eliminates the noise of the background. And obviously, once you take the photos, now you have to use some basic editing software for cropping and putting your photos, making them straight and cropping them. So basically, you don't need any special or any sophisticated software, editing software, because all you're going to do is just spend money. Because if you take a high quality photo, all you need to do is put it straight and crop and then save it. That's all you need to do. Just any type of software that can arrange the position of the photo and then finally crop it. So what are the camera settings that we're going to be using? So this is the important portion of the lecture, because this is what you should know so that you do not make the beginner's mistake of trying to use your camera in a automatic setting or upper priority setting that will actually make all your functions or make the decisions for you. You have to decide what kind of ISO you want to use, what kind of f-stop you need to use, what kind of shutter speed you need to use. You are going to select that. And it's a very simple way to do it. So the aperture, this is the f-stop. What is the aperture? When you adjust your aperture setting on the camera, the f-stop, you'll see that the opening of your lens gets bigger and smaller. In other words, if you look at the photo that I'm showing you right here, if you have a large aperture, and the large aperture means that you have a very low number right next to your f, that your f-stop would be a 2. Look at the size of that of the opening in your lens. That means that when you take your photo, there's a lot of light that's going to come through that lens, meaning that your photo is going to have a lot of light. When would you use a very low f-stop? You will use a very low f-stop if you have very bad lighting conditions in the area where you're going to take the photo. So now I'm going to ask you, when you're doing dental photography, when you're doing intraoral photos, do you have any lighting problems? No, because you either have a ring flash or you have a dual point flash. So you have light that is being emitted directly to the area that you're going to be taking the photo from. So you will never use in intraoral photography either f2 or f8. You're going to use always from f22 and above. And basically what you're going to be using is f22 and f32. Those are the two settings that you're going to use the most for the aperture. The only time you would use f8 in dental photography is for a full photo shot. Okay? So narrowing the aperture means that more of the photograph will appear to be in focus. So that's another benefit. We're very close to our subject. We want to control the amount of light, and at the same time, we want to control the sharpness of the photo. So the higher the f-stop, the sharper the image. And not only the tooth that you're focusing on, but the neighboring teeth as well. And I'm going to show you a couple of photos where I've made the mistake of selecting the wrong f-stop, so that you can and this is one right here. You see, what's wrong with this photo? Look at this photo. See the middle tooth. The only area of this photo that is actually in focus is that liner that you see in the floor of that cavity. But if you look at tooth number 3 and you look at tooth number 5, they're both out of focus. If you look at the actual tooth number 4, on the buccal, it's out of focus. On the lingual, it's a little bit more in focus, but it's still out of focus. So the only area that is actually on focus is that spot on the pulpal floor, on the distal pulpal floor. So this photo, what's wrong with the photo? The f-stop was off, was wrong. Incorrect f-stop. This is a correct f-stop. Look at the difference. Now you can see this photo. The tooth is very sharp. The whole tooth is very sharp. But the actual rubber dam on the right and on the left, and actually the clamp, is sharp as well. So the whole photo. So when you control the f-stop correctly, when you're in f22 or f32, probably I use f32 for this photo on the right, not only you can control the light well, but you're going to control the sharpness of that photo as well. The shutter speed. What is the shutter speed? So the shutter speed is the specific amount of time that the actual shutter of your camera, the amount of time that it takes to close. So let's look at these two photos on the bottom. One has a shutter speed of 30, the other one has a shutter speed of 1600 of a second. So when you take a photo with a shutter speed of 1600 of a second, this is so fast that you're going to capture every single molecule of the water in movement. And that's what you're seeing on that photo on the right side. On the other hand, on the left side, with a shutter speed of 30 of a 30th of a second, now the water's coming out. The shutter speed takes more time to close. You're not gonna see the detail of the motion. So the faster the speed, the sharper the image. So here comes another question. In dental photography, how sharp do I want this image to be? Well, in dental photography, I want my image to be very sharp. I'm not going to go to 1600 of a second, because if I do that and I move a little bit, now the photo is going to be blurry, or it's going to be moved. It's going to be out of focus. So I cannot use that speed, but I can use 200. It's a good speed for dental photography. So this is what I'm referring to when I say you select the different options that you need to set your camera on. So the shutter speed for dental photography, 1 to 200 of a second. This photo was taken with an f-stop of f22 and a shutter speed of 200. So this is the combination of both concepts. I'm controlling the light, I'm controlling the focus, obviously with my f-stop, and now I'm controlling the sharpness of the photo with my shutter speed. The ISO, or the International Standardization, it refers to the International Standardization Organization. But what the ISO does is that with the low ISO, is that the light in a given exposure is more accurately represented. The opposite is with the high ISO. So if you want high ISO, are particularly used for picking up more details in, like, let's say, landscape photography. But in dental photography, look at the photos here. You have the Eiffel Tower in the same photo, the same element, the same amount of light, with 4 different ISO settings. Where do you want to be? See, you look at the ISO 1600. You don't see, there's a lot of light. So when there's a lot of light, you see less detail. There's more detail, or a little bit more detail, in between the 200 and the 400. So in other words, for dental photography, you want to have more detail. You're going to be on the low end of the ISO. This is ISO 200. Look at the detail in this photo. You can see the crease lines. You can see all the stains. You can see the orange type of texture on the gingival of this patient. You can look at every single detail on the teeth of this patient, and they're there because we have the right settings. Now, don't forget, it's not only the ISO, it's not only the f-stop, it's not only the shutter speed. It's a combination of all these that give you a high quality photo. So I'm giving you the numbers that you have to use in order for you to be successful in dental photography. So the question is, should your camera ever be used in any other setting but manual setting? And the answer to that question is no. You're always going to use manual setting for your dental photography photos if you want to be under control. So this gives you complete control of all the settings. You're going to choose them, and that's where your camera setting should be placed on. It should be placed not on auto, not on automatic. It should be placed on manual settings. Okay? And that's the manual settings. You're going to put the color balance and color temp, or color and temperature. That's going to give you a good reflection of the actual natural colors of whatever your patient is bringing to the office. You're going to have your shutter speed in between 200 and 250. These settings are always going to be the same. They're not going to change. Your ISO is always going to be in 200. None of these 3 settings, the white balance, the shutter speed, or the ISO, are going to change. The only setting you should change while doing dental photography is going to be your aperture setting, your 32 or 22 or 8, depending on the distance between you and the subject. And that's the one that's actually going to change. Okay? And this is just to remind you about the sticker that we already spoke about that was on my camera lens. You can see the only one that I'm modifying is the f-stop. And the f-stop is going to be modified based on what? based on the distance between me and the subject. So now let's go to the technique. Let me show you how do I do. And by the way, that photo that you see right there, those are the Niagara Falls in Rochester, New York. And guess who took that photo? I'm going to tell you right now, it was not Dr. Haddock. So now you know who took the photo. So let's start with the full face photo. How do we obtain that photo? So number one, and we want to thank obviously Dr. Megan Todd, that she's actually our model for the photos, and she was very kind of us. It was very kind of her letting us actually take her photos and use her for this presentation. So we want to. She actually works. She's a faculty. She's a dentist, and she works with us at the dental school. So the first thing that I do is just like you see here, I have my white lab coat. I have my gloves on. I haven't placed my hands in the patient's mouth. These are brand new gloves. I'm going to hold her head for this photo. This is how I start. I start with the external photos, with the full face photos, and then I work myself in. And I'm actually extending my hand so that I can arrange the way that I want her to put her head, because normally patients will tend to tilt their head back, and that way the way that the shot is taking, the head is either back or down, excessively down, and it's going to give you an image that is not the ideal image for your diagnosis. So you need to have the patient with the face fairly straight to the actual camera. So that's what I'm doing there. Once I do that, I arrange my camera to the correct setting. I put my f-stop either at 8 or 10, and I go ahead and take that first shot. And that's my first facial shot of the patient. And you can see the distance approximately that I have. I would say that I'm actually probably 2 meters away from the patient, from the actual subject, to take this photo. Okay, so from the full face photo, now we're going to go to the extraoral photos. So now I'm going to be closer to my subject. I'm probably, I would say, 50 centimeters away from the patient at this point. And you can see I'm holding my camera. The patient has the head in the right position. I'm going to count to 3, and I'm going to ask the patient to smile. Now you can see that for this photo, I'm not looking straight ahead to my patient. The camera is slightly angulated, going from the top to the bottom, the lens, so that I can capture that photo coming from the top to the bottom. This is my first extraoral shot, and I'm a lot closer to the patient compared to the first photo, but I am, at the same time, I'm using a higher f-stop because I need to have less light, I need to have the sharpness, and I'm still using the same. Don't forget that the other 3 elements we do not modify at all. The only one that I'm modifying is actually my f-stop. And as you can see, I'm going to modify very, very little. Now, this is the second smile photo. What do you see difference between this photo and the previous one is that this photo is more straightforward. So I take one that's slightly inclined, and then I take one that is less inclined, more straightforward. So I have those 2 views of the patient's smile. And as you can see here, I'm using exactly the same f-stop, and I'm actually exactly at the same distance from the subject, approximately 50 centimeters away. Okay, now we're going to go to the intraoral photos. And this is the part that I was telling you, that we have the patient actually help us with the intraoral photos. So I am actually holding on to the retractors, and I'm putting them in the patient's mouth. Then I ask the patient to bite down, and I separate the retractors, and I ask my patient to hold the retractors as further away from her mouth as possible. This way, I know that I'm not hurting the patient. The patient will actually retract as much as she or he can without causing any pain or great discomfort to the patient. That's why I want to have my patient help me do this. I don't have my assistant, and I don't do it. Obviously, I cannot do it myself because I'm going to hold the mirror and I'm holding the camera on the other hand. Now, I'm going to go ahead and I'm going to tilt the patient's head so that I can have her face me, because she's seated at this point in the dental chair. I move her face, I have her face me, as to have the best position possible, and then I go ahead and I dry the teeth. Every single dental photo, ideally, should be taken with the teeth dried. So I dry the teeth, and look at the distance, 50 centimeters away, 20 to 22 on my f-stop. I take the shot, and this is the photo. Now, since I'm 50 centimeters away, you can see that I can view central, lateral, canines, bicuspids, and molars. I have a view of the whole maxillary and mandibular arch and the facial aspects of all premolars and molars. So this is why I'm not so close to my patient. Now, if I want to go ahead and get a narrower shot, I want to see more detail in a few in less teeth, then I need to get closer to the actual subject. So I'm going to take, like, for instance, a bleaching shot. This is a photo that we use for a bleaching. So just to kind of show the patient what is the comparison between the maxillary and the mandibular arch before we start actually bleaching the maxillary arch. So we have the patient come edge to edge. We place the retractors. We help them retract. We have them then hold the retractors. Then we blow air to her teeth. So we get rid of all the saliva. And we ask our patient to put her tongue, or to take her tongue all the way to the back, so that we don't get the tongue coming through the teeth. This is a very important tip. We don't want to see any tongue on this photo. We just want to see the retracted lip. We want to see the teeth. So now you can see I have edge to edge. I still have a very good field of view. I'm viewing the buccal areas, buccal surfaces of canines, bicuspids, and actually the first molar. And I'm using the exact same f-stop. And you can see the distance that I am from my subject at this point. Now, same f-stop, but what did I do? Now I made my field of view a little bit narrower, meaning that I came closer to my subject. Now you can see that we cannot see molars. We can only see up to the first bicuspid, then the canines, laterals, and centrals. The same technique. Patient retracts, we dry, and then we take the photo. Okay, now we're going to go to our occlusal shots. You see, now the patient has inverted the retractors. Now we're not using the wide part of the retractors, we're using the narrow portion of the retractors. And we ask the patient to hold only the upper lip. So we show her how to do it, just like we did for the full retracted, for the maxillary and mandibular arch retracted photo. We kind of show her, guide her, and we have her separate the lip from the upper arch, from the maxillary arch. We dry the facial and occlusal surfaces of the teeth. Then we place the mirror inside the patient's mouth with that angulation. I'm holding the mirror with my left hand, and I'm holding my camera with my right hand. And I have the patient breathe through her nose. Now, you have to take, this photo has to be taken very quickly, because if the patient starts breathing through her mouth, you're going to get this mirror blurred. You can have your assistant, and this is the reason why I have my patients hold the retractors, because at this point, my assistant has both of her hands free, and I can ask her to actually blow air to the mirror and get, so that it can help me eliminate any blurriness or any fogginess of the mirror that I'm actually having, because the patient is breathing through her mouth. But I always tell my patients, please breathe through your nose. And then we take the photo. And you see me right there. Look at the angulation. I'm standing up. The patient is seated all the way up. And this is the photo that we obtained from that position, and with that f-stop right there. Now, there's another way of taking the maxillary photo. And this is standing behind the patient. Same retractor, same ends of the retractor. The patient is holding the retractor. My assistant is blowing air to the mirror if I need her to do that. I am holding the mirror against the occlusal surface of the mandibular teeth, just like I did on the previous photo. The only difference here is the position of the patient and the position of the photographer. On the first technique, you are standing in front of the patient. On this second technique, I'm standing behind the patient. Okay, now we're going to do the mandibular shot. For this photo, you always need to have your patient leaned all the way back on the dental chair. So you lean the patient all the way back. Now we have her retract the lower lip. We dry the facial aspect and the occlusal surfaces of the teeth. We have the patient place the tongue against the palate. You can see that on the left photo. And now we're going to push the tongue with the mirror towards the distal, towards the back of the patient's mouth. We have her open wide, and look at the camera. Look how close I am from my subject. These photos are all the same. Maxillary and mandibular, I'm actually at the same distance. I'm holding the mirror. Patient is breathing through the nose. Look at the angle. I'm looking at the mirror. I'm actually focusing on the mirror. The reflection of the occlusal surfaces of the mandibular teeth on that mirror. That's the shot I'm taking. And then I take my photo. Same f-stop. Look at the photo. Look how dry that mouth is. Look how well the lips are retracted. I push the tongue all the way back. My mirror is actually seating distal to the second molars. That's how you take this photo. This is the technique and the way that you should place a mirror for this specific photo. And you can see I'm holding all the mirrors. I'm always holding the mirror. You don't see any assistant or anybody else in these photos holding the mirrors. And I say this because my students make this mistake every single day. They have somebody else holding the mirror for them, and then this person moves or tilts the mirror either up or down, and this is going to definitely affect the way that the photo that you obtain. So you want to be in control. You want to hold the mirror because you're the one that is looking to the mirror. You know exactly what you're aiming at and what you are trying to obtain as a final photo. So now I have patient is retracting both sides. The difference of this retracted technique is on the right side of the patient, the left side of the patient, I'm sorry, she's using the wide portion of the retractors. On the right side, on the other hand, she's using the narrow portion of the retractors. So this will let my mirror fit in better. Now my mirror goes in, I take it all the way back distal to the second molar, and then I separate a little bit more her cheek with the mirror. Now I have my assistant blow a little bit of air to the mirror, and now I can take my photo. And this is the photo that we obtained with this technique. Look at the distance. Look how close I am. Obviously, my f-stop, you have seen that it has not modified at all during all the intraoral images. And this is the opposite side. Now, the opposite side, in this case for me, is her right side. I'm left-handed. So you can see that my hand is now going on top of the camera. So always, your opposite side is always going to be the most difficult photo for you to obtain. So you just got to practice, and probably you're going to take more than one photo for the opposite side because obviously it's a little bit uncomfortable to have your arm on top of the camera and at the same time holding the camera. But as you can see here, it's doable. And you know, I always tell my students, practice makes the master. The more photos you take, the better you're gonna get. So that's why I take photos every single day. Because even though I've been doing this for many, many years, I still have a lot to learn and I still have a room for improvement. Okay, and that was the final photo of our presentation. I think that we've been online for an hour and 20 minutes approximately. I hope that everybody that has been listening to us has enjoyed the lecture. If you have any questions, please raise your hand and I will open your microphone, or you can type the questions. If you have any final messages or any final thoughts that you would like to share with us, you can write them down or you can raise your hand and I will open the microphone for you. I'm going to give you a minute to raise your hand or to write a question, and I will be more than happy to answer that. If you want to do this live, I can open the microphone for you, and I will let you ask the questions either in Spanish or in English. Not a problem. Okay, Doctor Hidalgo raised his hand. Let me open the microphone for him. Doctor Hidalgo, ¿me escucha?
Sí, sí te escucho.
Dígame, ¿en qué lo podemos ayudar? ¿Qué pregunta tiene para nosotros?
Claro, mi duda es sobre los espejos. ¿Cuál sería el más recomendable? Porque hay unos que son de vidrio que yo los he usado y me dan a veces como una doble imagen.
Ok.
Y existen también los de acero, solo que no los he usado y no sé qué tan... Parece que son los que usted usa, no sé
No,
qué
mire,
tan buenos sean.
muchas gracias por su pregunta, doctor Hidalgo. Lo voy a tener con el micrófono abierto y le voy a
Sí,
responder la pregunta primero en inglés y luego se la voy a responder en español. ¿O está bien que se la responda en inglés?
sí, está bien.
Perfecto, entonces se la voy a responder en inglés. So the question that Dr. Hidalgo asked us today is, what type of mirrors do I use? Because he knows that there are metal mirrors and there are glass mirrors. Well, I've used both. And to be honest with you, Dr. Hidalgo, I started using metal mirrors. When I bought them initially, the idea that I had and the way that they sold me the metal mirrors was that these mirrors compared to glass mirrors, these do not scratch. They don't get any scratches on. Well, My mirrors had a lot of scratches, the metal ones. So they scratch just like any other mirror. You have to be very careful with them. They are very good. They're very nice mirrors. They reflect very well. You can take really good high quality photos with them. But the mirrors that you're actually seeing right now, and every single photo that you have seen in this presentation, either taken by me or by Dr. Haddock, we have both used only glass mirrors. These are um, these are obviously just regular intraoral mirrors that they sell them everywhere. If you are getting a double image, that is probably the quality of the mirror. There are what we call I think they're called non-refractor mirrors that they are, they don't give you this double image, and they sell these mirrors for intraoral use, just regular dental mirrors like any other mirror. But they sell the same technology they have for these photography mirrors. And the whole idea is that you don't get this double image on the mirror. So that has probably to do with the quality. To be honest with you, I buy all my mirrors and my retractors and my contraster from PhotoMed, and they have a very nice web page. I don't get any money from PhotoMed. I don't get any money from anybody. I'm just giving you a really good advice because I think that their mirrors and their contrasters, they're not expensive. The contrasters are like 20 or $22. The mirrors are around $40 to $50, and you only have to buy a couple of sets because you can sterilize them very well. You can either sterilize them in cold solution, or you can sterilize them in you don't want to put them in your autoclave because that will damage the mirror, but you can sterilize them in gas, or you can you can sterilize them with any cold solution and just wipe them off. And there's many things that you can use today for that. But definitely these are all glass mirrors. We do wrap them very nice when we're going to send them to be sterilized in gas because we don't want them to get scratched, but they will eventually get some scratches. Now, when they do get a lot of scratches, we just throw them away and we buy a new pair. I mean, like I said, you're going to spend $100 in mirrors and probably $125 with a black contraster. I don't think that's a really bad deal for something that we are actually charging to do, because when in my fees and everything I do, I have involved everything that's behind the curtains, my photos, everything that I put into my work for the benefit of my patient. So, at the end of the day, I don't think that you're going to, and like I said, you can either use metal or glass. I think that if you're getting a double image, it's because of the quality of the glass. I can highly recommend the mirrors that PhotoMed sells, because those are the ones that I use. Those are the ones that you're looking at right now, and they are very good quality mirrors. And the ones that we are using at this point, the photos that we're taking right now, those mirrors that you're seeing right there, they're used by hundreds of students. We have 85 students per class, and we have junior and dental students that actually are in the clinic using these mirrors. So they are extremely used, and you can see that they are still in good quality. But we do change them when we need to change them, but that's not that very often. So hopefully I did answer your question. Did I answer your question with this?
Sí, perfecto.
Thank you very much.
Muchas gracias.
Ok, ¿alguna otra pregunta que tenga algún otro? Pueden levantar la mano y encantado les respondemos sus preguntas. ¿Tiene alguien alguna otra pregunta o comentario? Mire, el doctor Haddock nos acaba de hacer el favor, le agradezco mucho al doctor Haddock, y esa es la importancia, tener la ayuda. Y el doctor Haddock, pues de aquí en adelante nos va a estar llevando de forma permanente en este tipo de cursos, pero el doctor Haddock acaba de subir el enlace de la empresa PhotoMed, que es la que nosotros utilizamos para comprar los espejos y los contrastadores. Como les dije al comienzo, no tenemos ningún interés comercial en esta empresa, para nada, simplemente la recomendamos porque realmente hacen buenos productos. Bueno, creo que nadie más tiene ninguna otra pregunta, así que there's no more questions. We don't see anybody raising their hands. We don't see anybody typing down. We just want to thank everybody that attended our lecture today. This lecture has been recorded, so hopefully we're gonna put it up in Facebook and on YouTube so that it can be reviewed. But we really want to thank everybody's attention, and we mainly want to thank the sacrificing your time to be with us tonight, and for your very valuable questions. Thank you very much, and have a good night from Augusta, Georgia, and from Dr. Romero and Dr. Haddock as well. Thank you very much.